Hi, this is Dr. Nelson with Freedom Healthcare. Today I want to talk about a subject that affects men to some degree or another at some point in their life. Every man after about age 40 starts to eventually experience some form of erectile dysfunction. And also within this subject, we want to talk about Peyronie's disease, which is an abnormal curvature of the penis. But erectile dysfunction is a difficult subject to talk about, but it's incredibly common. And so let's have the discussion. First off, what is the cause of the problem? What I talk to patients about is there's two issues at play here. There's a mechanism of an erection, which we can consider like a machine that needs to run off of a certain voltage. Let's say this machine runs off 120 volts. And then there's a generator of electricity. And there could be problems here. If you're generating only 30 volts, then your machine is not going to run properly. So there could be problems in both areas. Now, every man as they age, their testosterone goes down. So anyone who's experiencing any form of erectile dysfunction at all needs to have their testosterone checked. That's part of the generation of electricity, so to speak, to run the mechanism properly. If your testosterone, it may very well still be normal, but it could be clear down at the bottom end of normal, and now you're suffering from all these effects. So I have a lot of times where patients will come in and say, well, I had it checked by another doctor and they said it was normal. And I look at the labs with them, I say, yeah, it's normal, but boy, I tell you, you're way at the bottom of normal. And normal range on testosterone is based off of the average American male being the average American size, the normal BMI of an average American male, which these days is tending towards obesity, and every man from 18 to 100 years old is within the normal range. So if you're clear down to the end, you're functioning like around a 100-year-old. So first off, make sure you get your testosterone checked and see that it's in the optimal range of normal. But today, what we're talking about is how to fix a problem with the mechanism of action. The mechanism of erection is a vascular mechanism. And as we age, our vessels start to deteriorate. We get microplaque built up, which causes the vessels not to be able to dilate properly. And an erection is a vasodilation event. So in order to fix that problem, one of the mechanisms or one of the treatments that treats the real cause of the problem is what's called extracorporeal low intensity shockwave therapy. A lot of people just know it as shockwave therapy or low intensity shockwave therapy. This right here is a machine that generates low intensity shock waves. So the treatment consists of 6 sessions that last about 20 minutes each. And just to help people understand what the treatment is like so they're not uncomfortable with it, because it's a sensitive issue and a lot of people are uncomfortable with not, if they don't know what happens, it makes it even more uncomfortable. So this machine will generate pulse waves, shock waves through this handle here, and we run that up and down the shaft of the penis where the blood flow problem is, and also down below around the testicles where the blood enters into the area to help improve blood flow throughout the whole area. Like I said, this treatment can take around 15-20 minutes, and it can cause little pinprick type sensations, but you don't have to worry about that. Prior to treatment, we give men a prescription for a topical numbing cream, which totally numbs the area so that there's no sensation, no possibility for any physiologic reaction down there during treatment whatsoever. And then the treatment, the medical technician will do the treatment, running the pulse wave generator up and down the shaft of the penis and down around the bottom where the blood enters. Like I said, there's a series of 6 treatments. Now, everyone will improve with this. The amount of improvement depends on where your baseline is. Some people just need the series of 6 treatments. In fact, most men do, and their improvement is very profound or pronounced. Occasionally, for men who are much older or have very deteriorated function, they'll need to go through 6 sessions and then another 6 to get to where most men can get with just 6 sessions. And as far as side effects, there's none. This is a completely non-invasive treatment. There's no pain involved, there's no downtime, and then the benefits will increase between the end of treatment and all the way to 8 to 12 weeks later. So I tell men, don't tell me how good or bad it worked until you are 8 to 12 weeks after your last treatment. And then at that point, there's maintenance treatments that need to go on because as we age, we continue to try and deteriorate and we need to help rejuvenate. Usually men will need maybe only one session, not 6. And that can be in a frequency anywhere from once a year to twice to maybe 3 times a year, depending on the patient. And there are a few other things that people can do during the course of the treatment that will enhance their recovery. And so make sure you talk to us about that when you come in for your appointment. But one of those things I want to mention right now is the Prp injection. So make sure you watch our video on the Prp injection so you understand what that is and how it works.